So in this video we're going to talk about the electrical activity in the heart. And so we measure the electrical activity in the heart with an EKG or an ECG, okay, an electrocardiogram. And so what it's going to do is it's going to measure different waves. And so we've got a P, a Qrs complex, and then a T wave. And so when we look at this, the P wave represents what's called atrial depolarization. Now, if we took Anatomy 1, where we talked about muscles, and we talked about depolarization and repolarization, we depolarize in order to get the contraction, and then we repolarize to reset everything so that we can contract again. So when we have atrial, that's the atria of the heart, we have atrial depolarization, that's going to cause contraction of the atria, and then we're going to have to repolarize the atria. Now, the Qrs complex represents, so the P is the atrial depolarization. The Qrs represents the ventricular depolarization, and so it's a big spike, okay? And that is going to actually cover up the atrial repolarization, so you don't see the wave for atrial repolarization, but it's happening at the same time that the ventricles are depolarizing, okay? Then we move, and again, as the ventricles depolarize, so that the ventricles can contract. Then the ventricles have to repolarize as well, and so that's going to happen when we have the the T wave. And so the T wave is going to be the repolarization of the ventricles. And so again, think of depolarization like this. We become less negative, okay? So when we talked about like skeletal muscle, we said that it's around negative 90 on the inside of muscle, somewhere in approximately in that range. And so we're going to decrease the negativity or the charge inside the cell, okay, because we're pulling sodium inside the cell, which is positive, and we're changing the charge. And then repolarization, we let potassium out, and then that's a positive ion also, and so that's going to bring us back to, as we have a positive ion, a cation leaving the cell, we have the charge inside becoming more negative again. So depolarization is becoming less negative, repolarization is becoming more negative until we're back to our resting membrane potential. So that talks about the ECG portion. Now, as far as generating the impulse, the cardiac cells have some differences between skeletal muscle. One is they have something called automaticity. Automaticity means they have, 1% of the cells have the ability to generate their own depolarization. So this depolarization process, which starts in the atria, is actually generated by something called the SA node, okay, the sinoatrial node. That's what's going to set your heart rate, okay? So that's what sets basically your rate of contraction, and so that depolarization is controlled by the SA node. Now, it's going to depolarize both atria together. I talk about in class that the heart works as a functional syncytium, which is a single coordinated unit. So you get contraction of both atria together. Then you have, as the impulse moves through, you have contraction of both ventricles together. But another key important fact is when that SA node generates the impulse, it's going to move through the atria, but then it's going to, before it gets to the ventricles, it's going to move through the AV node. So the SA node starts it, the AV node, it's going to move through there. What that does is slows down the impulse by about 0.1 seconds, and that's going to slow it down enough so that the atria can finish contracting, so before the ventricles actually contract. Because if the impulse moves into the ventricles too soon, then the ventricles will contract and shoot the blood back up into the atria. This is not going to be an effective process. So the AV node, what it does is it delays the impulse, slows it down as it's moving through the AV node. Once it leaves the AV node, it moves through a number of branches, gets through the rest of the myocardium in the ventricles. The ventricles contract. As the ventricles depolarize, they will contract. And then, of course, eject their blood in the appropriate places, which is through the pulmonary trunk to go to the lungs and through the aorta to go to the body. So that gives you some idea of some of the controls of the electricity in the heart, as well as if we're looking at an ECG, some of the things we'll be seeing. If you have any questions, let me know. Stay strong. I'll see you next time.